Welcome to Deep Dive Dialogues, where we explore the transformative role of cytogenetics in shaping personalized medicine. We are delighted to introduce our distinguished guest, Dr. Ashish Fauzdar, Head Clinical Genomics, Redcliffe Genetics. With over 23 years of experience in genetics and genomics, Dr. Ashish has contributed his expertise to academic institutions, research centers, hospitals, renowned art infertility clinics, and diagnostic laboratories. He has authored over 25 scientific publications in index journals. He is highly skilled in genetics and genomics, specializing in techniques like cytogenetics, molecular cytogenetics, and chromosomal microarray, with extensive expertise in reporting. Dr. Ashish is deeply passionate about clinical interpretation of genomic data, particularly utilizing clinical exome and whole exome sequencing platforms. He excels in communicating findings to both treating physicians and patients through genetic counseling and empowering them to make informed decisions for optimal patient management. So, welcome, Dr. Ashish.
Thank you, Dr. Manisha, for the kind introduction, and I'm looking forward to this discussion.
So, to begin with, Dr. Ashish, could you elaborate on the significance of cytogenetics in diagnosing genetic disorders?
As we know, the branch of cytogenetics was way back discovered in 1970s, and over I think 4 or 5 decades, this branch is still relevant in diagnosing chromosomal disorders. And you will be very surprised. Still, we find a lot of patients with different kind of chromosomal disorders, and conventional cytogenetic techniques have become very handy in diagnosis of these chromosomal abnormalities, be it a lady of or a couple with recurrent pregnancy loss, implantation failures, baby with different birth defects, cancer patients. Conventional cytogenetics, or you can say karyotyping test, which is, you can say, another way of saying conventional cytogenetics, is playing a very important role in diagnosing, prognosis, and treatment of these patients. So this is a very useful technique in this era of next generation sequencing, still a very relevant technique.
Yeah, it's a very relevant tool. I agree.
Yeah.
So, how has the integration of genomic techniques with conventional cytogenetics changed the clinical landscape?
So, conventional cytogenetic techniques are, as I said, it's playing a very crucial role, especially in treatment of, you can say, recurrent pregnancy loss ladies who have experienced 4 or 5 miscarriages.
Right.
And now the clinicians are looking for answer. They have done all advanced genetic tests, including even microarray and NGS. Different techniques have been done, but still no answers are provided. So once they offer a conventional cytogenetics technique like karyotyping, they may find out that they are carriers of balanced translocations. So now the approach will be totally different in these group of patients, because they are not now going to be offered pre-implantation genetic testing for structural abnormalities, and this is now their course of treatment now going forward. So you will see, even in implantation failures, so there would be women or men who are carriers for chromosomal disorders like Klinefelter syndrome,
Yeah.
Turner syndrome.
Yeah.
So if these women are carriers for these chromosomal disorders, they are not going to deliver a healthy baby, or there will be recurrent episodes of implantation failures or pregnancy losses. So it's still a very relevant technique, and it should be integrated in current clinical practice. And I see a lot of clinicians are opting these basic tests and offering them to their patient before going for expensive treatments.
Correct.
And there is a huge role in cancer, definitely, that we will discuss, I think, going later on the
Yeah.
discussion.
Right. So, what is the role of molecular cytogenetic technologies like FISH, fluorescent in situ hybridization, in clinical management of patients?
Fish has become a very handy tool in management of cancer patients, be it a diagnosing a cancer, or a hematological malignancy like CML, ALL, AML. So there are markers or cytogenetics abnormality which are very specific for these hematological malignancies. And fish, like in cases of breast cancer, they are even deciding the treatment whether they are going to get a targeted treatment. Like in breast cancer, HER2 fish is very handy technique, test which will decide what treatment has to be given. So molecular cytogenetics techniques like fish are playing a crucial role in diagnosing, prognosis, and treatment, deciding the treatment of the patient. And it has been vastly used by a lot of oncologists, hematolo-oncologists these days in different hospitals.
That is good. So, next technique, of course, CMA, chromosome
Yeah.
microarray, is an increasingly utilized technique. How does it enhance our ability to detect genetic variation compared to traditional methods?
So, chromosomal microarray technique is like a, you can say, advanced version of karyotyping, where in conventional cytogenetics we were culturing the cells in the lab, and sometimes, especially in the product of conceptions, these samples does not grow in the lab. And here the chromosome microarray technique has become very handy technique, where we are extracting the DNA, not culturing the cells, but we are extracting the DNA,
Okay.
and there are chances of getting results are very high as compared to conventional cytogenetics. And moreover, the yield, the diagnostic yield is very high, because here we are looking into the minute, at a higher resolution, or a even micro deletion syndromes and all. So this technique has been recently adopted by a lot of gynecologists, especially in getting some information from product of conception, where the ladies have recurrent pregnancy losses, whereas sometimes conventional cytogenetics fails to give results. And but there are certain limitations which should be aware. We cannot detect balanced translocations in chromosomal microarray technique, and also low level of mosaicism. So there are certain limitations, but there are more advantages rather than limitations, where a lady, we are patient, or a clinician is actually suspecting an aneuploidy, and the chances of results are high, and it is a very automated technique, and also the turnaround times are very fast as compared to conventional cytogenetics. So that's very crucial these days to get the results as soon as possible.
Right. So, turnaround time is rapid. That's
Very crucial for the
yeah.
diagnostic labs. Yeah.
So, my last question is, in the context of precision medicine, how do you see cytogenetics contributing to personalized treatment approaches for patients with genetic disorders?
So as in the start we were saying कि this conventional cytogenetics are still playing a very crucial role in this genomics era, where we have lot of NGS and next generation sequencing, Sanger sequencing, PCR, RT-PCRs. So if you see in especially in reproductive genetics, it
Hmm.
is going to have a big role in diagnosing of chromosomal disorders like Down syndrome.
Yeah,
I would say it is a gold standard technique for diagnosing a Down syndrome baby.
yeah,
Even adverse, a different kind of chromosome abnormality, and then there are certain markers where the doctor has already, based on the clinical suspicion, has established the diagnosis, and now she or he is looking for further confirmation of the results. Like a, you can say, Diageos syndrome, where fish with for Diageos syndrome will be a confirmatory test for the establishing the diagnosis. So this is going to play a big role, and still a very relevant technique in today's era.
yeah. So, it's conventional but still relevant.
Very relevant, yeah. And you will, I think, my key message would be chromosome abnormalities or a karyotyping based test are still a gold standard for diagnosing of chromosomal disorders.
Right. So, with this note, we conclude our session. Thank you, Dr. Ashish, for this wonderful talk. Thank you all for joining us.